Hello everyone and welcome to this video presentation. Thank you very much to all viewers for taking the time to watch this presentation, and a special thank you to the entire team of assessors and reviewers for their attention and support. Before we begin, let me introduce myself and my colleagues who contributed to this paper. My name is Hartanto. My teammates are Dr. Intan Paramita, Dr. Firman Wirasdo, and Mrs. Rian Andriani. We are from the Management Master Department at ARS University located in Bandung, West Java, Indonesia. Together, we conducted a review of healthcare worker burnout and mental health challenges following the COVID-19 pandemic in Indonesia. Today, we will delve into a critical issue impacting healthcare systems in Indonesia. Understanding this challenge and exploring effective management responses is essential for safeguarding the well-being of healthcare professionals and ensuring the sustainability of quality care. The COVID-19 pandemic has caused massive surge in patient loads and logistical challenges. This dramatically increased the burden on healthcare workers, especially in Indonesia, leading to psychological and operational pressure, and then ends up with high burnout rates and psychological distress on healthcare workers. This situation is exacerbated by excessive work hours, inadequate rest, fear of infection, limited social support due to isolation, and all of this can lead to mental health disorders such as depression, anxiety, and also PTSD. Our study seeks to review recent Indonesian researches on post-pandemic burnout and mental health crisis among healthcare workers. We also want to understand the prevalence and dimensions of burnout, including emotional exhaustion, depersonalization, and reduced personal accomplishment among healthcare workers. Additionally, this study also aims to identify the implications for hospital management and policymaking to support healthcare professionals. This research employs a narrative literature review analyzing peer-reviewed studies and survey data collected from 2019 to 2024. We gathered studies and survey data from various data sources such as PubMed, ScienceDirect, and also Google Scholar. The keywords are burnout, mental health, healthcare workers, Indonesia, and also COVID-19. Inclusion criteria centered on valid burnout and mental health assessments specific to healthcare workers, while studies without full access or lacking peer review were excluded. Our findings indicate that approximately 82% of Indonesian healthcare workers experienced moderate burnout during the pandemic. High emotional exhaustion was reported by 22.1%, high depersonalization by 11.2%, and low personal accomplishment by 29.4%. Additionally, mental health conditions were prevalent, with reported rates of depression at 10.8%, anxiety and stress both at 12.5%. These symptoms were more common among frontline workers, nurses, women, and younger professionals. The risk factors include job category, marital status, experience treating COVID-19 patients, and workplace environment. Burnout among healthcare workers during COVID-19 pandemic was intensified by pandemic-specific stressors, such as fear of infection, stigma, rapid changes in protocols, and also high workloads. Of course, psychological support programs such as counseling hotlines, like the Sujiwa hotlines, exist, but are insufficiently evaluated or broadly promoted, leading to critical support gaps. And also, we need to review the long-term effectiveness of these services. These burnouts negatively impact healthcare service quality, patient safety, workforce retention, and also harm the organizational stability. The physical work environment and workload were also identified as significant contributors to burnout levels, emphasizing the need for its systemic improvements. All of these issues point out the urgency for targeted mental health interventions and robust human resources management policies. As we can see, burnouts among healthcare workers impact the management and also the hospitals. Hospitals must prioritize creating safe and supportive work environments by improving physical conditions, managing workloads, and enabling adequate rest. Integrating comprehensive mental health services, such as counseling, peer support, and resilience training into hospital policies is also essential. Leadership involvement in promoting open communication and recognition of staff efforts is also crucial to reduce anxiety and burnout. Strategic human resource measures, such as flexible scheduling, psychological screening, and proactive mental health infrastructure investments, will build workforce resilience. Collaborative policy development involving ministries, hospital management, and professional bodies is also necessary to create scalable, data-driven interventions that sustain healthcare quality and worker well-being beyond the pandemic. In summary, Indonesia's healthcare workforce faces significant mental health challenges and widespread burnout due to the impact of COVID-19, affecting emotional well-being and the overall quality of patient care. Despite the agency, our current psychosocial support system remains inadequate, and disparities in the impact of burnout can be clearly seen based on gender, age, and occupation. Unaddressed mental distress among healthcare staff does not only threaten the individual worker, it jeopardizes hospital operations, workforce retention, and the consistency of care delivery, posing real risks to the reliability of the healthcare system itself. So, hospital and healthcare organizations must urgently adopt comprehensive strategies, including improving work conditions, expanding mental health support services, engaging leadership at every level, and committing to thoughtful human resource planning. Looking ahead, future efforts must focus on rigorous evaluations of mental health interventions, proactive engagement from leadership, and integrating psychological well-being into the core of health system governance for sustainable resilience. By making the well-being of healthcare workers a true priority, we ensure a healthcare system that remains resilient, effective, and compassionate in serving our communities today and for the future. Thank you very much to all viewers and to the entire presentation assessment team for your attention, support, and valuable feedback. If I made any mistakes or if anything was unclear, I sincerely apologize and appreciate your understanding. Please feel free to reach out with any questions or comments. Stay well and thank you again for your attention.